Hello dear students, this is Mushtaq from MC Society Institute of Pharmacy Azam campus. In today's lecture, we are going to learn about enteral route, its subtypes and its advantages and disadvantages. Outcome of this lecture, you will be able to describe the enteral route of drug administration. Second, students will be able to state the advantages and disadvantages of enteral routes of drug administration. So the word enteral has derived from the Greek word known as enteron, which means intestine. In this case, we place the drug in the GI tract, that is, which starts from oral route, that is oral cavity. Then comes the pharynx, esophagus, stomach, small intestine, large intestine, rectum, anus. So this tract is called as intestinal tract, or it's also called as just digestive tract. So when we place the drug in this route, that is in oral route or in GI tract, we call it as enteral route. So it has three subtypes which we have already learned in previous lecture, that is oral, sublingual and enema. So first, coming to the oral route of drug administration. In this route, it's quite simple. In day-to-day life, we use it a lot, like we take syrups, capsules, tablets, which is normally placed on the tongue and swallowed the preparation with the help of drinks like water, milk, etc. Sometimes the tablet is chewed by the patient before swallowing, and maximum drug absorption takes place in the intestine. So we can see the image, a person taking the drug by oral route. So what are the advantages of this route, oral route? Is first, it is commonly preferred and used route of drug administration. Maximum medications are consumed orally, and it's quite simple route that it can be used for infants to all age groups. It is very convenient, etc. So one-to-one advantages. First advantage of oral route is it is safe. That means no skills is required, like there is no need of injection. So if there is injection, there is chance of infection. So in these routes, it is quite safe. No need of special skill techniques to be used to introduce the drug, like injection, inhalations, etc. Second is very quite convenient. Each everyone can take it, and it is cheap. The drugs are available in for infants to all age groups. Administration is very easy. Self medication is possible, that is, there is no need of another person to introduce the drug, so the patient can take the drug. Supervision of physician is not required. Technical skill is not required. A layman can also take the drug by simple eating it. Aseptic techniques are not required, that is sterilization, etc. And reversibility is possible. That means if we have taken a drug and we came to know that the drug is wrong drug, so we can easily split it, or we can vomit it, and or we can clean the stomach, that is normally called as gastric lavage. So these are the advantages of oral route. Although the oral route is widely used in medical field, but it has certain disadvantages. Number one, the onset of action is very slow. It takes normally 20 to 30 minutes to maybe 90 minutes to start the action. So next, it cannot be used in nausea, vomiting, diarrhea condition. It is not useful in cases of unconscious patients. So unconscious patient cannot take the drug by oral route. A non-cooperative patient who doesn't want to take the drug, so it's will not able to give the drug forcefully. Second, it is not used in emergency conditions like in heart attack, shock, etc. Why? Because it takes much time, that is normally 30 to 50 minutes. Next, irritant drugs or unpalatable drugs cannot be given by this route, so it shows bitter taste. and the patient will not show any compliance. Next, 100% absorption is not possible. Why? Because the drug is degraded by digestive enzymes. So we have to give more drug to show the effect. So hence we have to give high doses of drug, and especially those drugs which gets degraded by gastric enzymes. Next, the drugs which are degraded completely by gastric enzymes we cannot give by this route. Example is insulin. If some drugs will not get absorbed properly because of presence of food, so all the drugs which are given by oral route first will get absorbed in the blood circulation of portal vein and then goes to the liver, and in liver there is chances that the drug will get metabolized, which is called as first pass metabolism or hepatic metabolism. So a lot of drug gets normally degraded by first pass metabolism, so hence we have to give high doses, and in some cases all the drug gets degraded, hence we cannot give those drugs by oral route. Example is testosterone. So these are the certain disadvantages of oral route. Next, sublingual route of administration. So in this, the medicament or tablet or capsule is placed below the tongue and is allowed to dissolve in the mouth cavity and gets absorbed into the blood circulation from oral mucous membrane. And from there, when they get absorbed, so they goes in directly into the systemic circulation and shows this effect. The example of medicaments which are given by this route is ephedrine hydrochloride in treatment of asthma, nitroglycerin in treatment of heart attack or angina pectoris. So it's also quite a simple route. That means simply the drug will be placed below the tongue and allowed to dissolve it there only. So it's quite easy, convenient, etc. So you can see the image where we have showing the drug is placed below the tongue. So you can see an animation of this route.
Rinse your mouth with water to ensure the sublingual space is moist. Carefully peel back the tab and gently push the wafer out from underneath. Lift your tongue, then place the wafer under your tongue on the left or right side of your sublingual space, pressing gently to hold the wafer in place. Close your mouth, relax your tongue, and don't suck, chew, or swallow until it is completely dissolved, which should take a minute or two. Say 5 to 10 minutes. For a double dose, wait for the first wafer to dissolve before placing the second wafer on the other side of the sublingual space. Thin membrane under your tongue. Medication goes directly into your bloodstream.
Advantages of this route: the onset of action is very quick, so it can be used in medical emergencies like angina, pain, asthma, etc. So the drug directly goes into systemic circulation, hence degradation in the stomach is avoided. Hence, since the drug goes into directly into systemic circulation, so first pass metabolism is avoided. Overdoses can be avoided, that is simply we can split the tablet by removing from below our mouth. So 100% absorption is possible as the drug is not degraded by digestive enzymes. Adverse effects and drug action can be prevented by simply splitting the tablet. So that is the advantages of this route. Since the drug is directly goes into systemic circulation, so it may affect the heart, so we have to cautiously administer the drug, especially those which shows adverse effect on heart. So it is only convenient for low doses of drug. uh, the drugs which shows toxic effect on heart we should be carefully administered. There is a chances of gum irritation may occur in our mouth, bad taste, and it is not possible to give the drug to the unconscious and non-cooperative patients. Some drugs may cause nausea and vomiting feeling because of placing the drug in our mouth, and so it's also not possible to place the drug below our tongue for long periods. So these are some of the disadvantages of this route, that is sublingual route. The next route is enema. In this route, we administered the liquid drug, a solid medicament, into our rectum. In the enema route, there are two types, evacuant and retention. As the name indicates, evacuant means it will clean the bowel. Retention means the drug or medicament is retained in the rectum. So we can see the images in which the drug is placed in the rectum or anal canal. So we can see a video in which we are showing you how the drug is injected.
Cheeks to visualize and gain access to the anus, or with the gloved, dominant hand, slowly insert the lubricated nozzle of the enema container through the anus into the rectum, or pointing the angle of the nozzle towards the umbilicus. Once the enema tube has been fully inserted, the nurse will gently squeeze the enema container to introduce the solution into the rectum and lower part of the large intestine. The enema fluid flows into the rectum, packing surrounding stool, filling the walls of the rectum and lower large intestine. Once the enema container is empty, the tube is withdrawn.
So the evacuant enema is employed to remove the fecal matter. It is also used to remove gases, that is called flectants. The maximum amount can be administered is 600 ml. So the water will helps to stimulate the rectum and slow pill lubricates. So normally this type of enema is used before surgical operations, delivery, investigation of GI tracts by X-rays, CT scan, etc., and also to evacuate the bowel, normally called as evacuant enema. Next is retention enema. In this type of enema, the drug administered contains a medicament that is retained in the rectum where it acts locally, or for example in ulcerative colitis, or it may get absorbed in systemic circulation, for example paraldehyde enema for production of basal anesthesia, and the quantity is around 100 to 120 ml. So advantages of enema route: it can be employed in hospitals and for old patients and children. It can be used in unconscious patients and non-cooperative patients. First pass can be avoided as the drug directly goes to the blood circulation, so hence no going of drug into the liver. Gastric irritation can be avoided as the drug is goes to the large intestine, not into the stomach. Duration of action can be controlled by using proper solvents, that is the modification of the formulations. Next, disadvantages: absorption of drug is slow, irregular, and unpredictable. Self-medication easily is not possible. The route is not used in non-cooperative patients, unwilling for administration. It is an invasive route and may be painful. Irritation drugs cannot be administered by this route. So why? Because it causes irritation and the patient will feel uncomfortable. In this route, incomplete absorption of drug may take place. So it's quite tough to predict the absorption. So what we have learned, that is the enteral route contains three types: oral, sublingual, and enema, and various advantages and disadvantages of enteral route. Thank you.